Richter syndrome remains a huge challenge for our patients with CLL. Fortunately, it's not that common, but when it happens, it can unfortunately be quite devastating, and we have very poor standard treatments for this. So we decided to try to build off one of the currently used standards of chemoimmunotherapy, a regimen called R-EPOCH, and we added the BCL2 inhibitor Venetoclax to this in a multi-center study, and recently published our results, and we saw 50% of the patients achieving complete remission, which compares quite favorably to historical studies where we'd expect about a 20% rate with chemotherapy alone. And importantly, this is translating into prolonged progression-free and overall survival with an OS close to 20 months, which, compared to median of 3 to 6 months that we've seen with other regimens like chemotherapy alone, we think that does look quite favorable. We did see a fair amount of toxicity, especially in older patients with our EPOCH backbone of chemotherapy. They tend to have high rates of infection and febrile neutropenia. And so we're currently now running a study of Venetoclax with R-CHOP, similar idea of chemosensitization with the BCL2 inhibitor, but hopefully with a less intense chemoimmunotherapy background, we'll have a lower rate of toxicity. And so that study is ongoing. There's a lot of other interesting studies going on in Richter's right now using targeted therapies alone. And so that's another area that I'm watching closely to see if we can develop a chemotherapy-free regimen for Richter's in the future.